Tonight, we're going to talk about swimming, and I want to quickly introduce our speaker, Dr. Evan Kahn. Evan Kahn is a sponsor of Carolina Multisports, and I wanted to give him the platform because I see him quite often. He keeps me going down the road, and he has so much information that he and I chat about during our sessions, and I just thought it would be a fantastic opportunity to really break down all of these sports throughout the year and to give you guys a chance to meet Dr. Kahn, benefit from his expertise, but then also dig a little deeper into what we've called the triathlete anatomy. So with that, Dr. Kahn is a graduate from the University of North Carolina, Chapel Hill here locally. So he also went out to California. I won't hold that against him. But took a sports medicine path at the Southern California University of Health Sciences, where he learned to blend physical therapy, orthopedics, and the manual medicine. So he's also worked with two Team USA teams, which is really cool. So which teams for those, by the way?
Yep, I worked with USA Archery and USA Fencing.
Archery and fencing. Well, awesome. And in his spare time, loves to golf. He also does a golf analysis, as I've seen at his clinic, but loves to run and hike with his wife and newborn son. So he's a new dad as well. When was the new one born?
Yeah, he's 10 months old now.
10 months old. Awesome.
Yeah.
So he's recovering maybe from some sleep deprivation. But with that said, Evan or Dr. Kahn, why don't you take it away here?
Thank you, Joel. Appreciate it. Yeah, so my name's Evan Kahn, and today we're going to go over the anatomy of the swim and kind of the functional anatomy and what that means, how it pertains to certain movements. We're going to kind of break it down. We're not going to get really detailed, but we are gonna try and broad brush it just a little bit, just so that it's not a total lecture here. But without further ado, we can go ahead and start if I can figure out how to do that. There we go. Okay, so we'll start with the pull. The pull is the pull. So we're moving the arm downwards, and there are plenty of muscles involved with that. Primarily the internal rotators and the extensors of the shoulder are the muscles that are most involved, and I'll bring up some images that kind of show exactly what muscles those are. But included in the pull are part of the wrist flexors, flexing the wrist downwards, and they are contracting to some degree, while the abdominals are also very much engaged to bringing the arm closer to the body. So there's a lot that's happening in just a really small amount of movement as we're just bringing the hand into the water and then bringing it down towards you. There's a lot that gets engaged here, mainly the front of the shoulder, down the arm, into the lat, the pec, the abdominals. They're all engaged as we're trying to bring the arm downwards and through. So let's take a look at some of the muscles here. So these slides here, they kind of get to show how layered the muscles can really get when we're looking at anatomical pictures. If we look at the muscle on the left, or the slide on the left, we've got the front deltoid that's covering up the pec major, which is covering up part of the serratus anterior. The lat is involved with this part of the swim movement. We're going to get into the abdominals here in just a little bit, but they play such a key part into bringing balance and tension. And if we look at the slide on the right, we're seeing really a lot of the detail of this part of the anatomy, this part of the torso. Again, looking at the pec major, pec minor. So there are two pec muscles. They don't do the same thing, but they are in the same vicinity. they do bring the arm forward, and they are going to bring the arm across you just a little bit. So important muscles. Downwards with the lat and the serratus anterior, that's a huge muscle. The serratus anterior is a muscle that's actually connected to the shoulder blade onto the rib cage. And it's kind of hard to imagine what that does, but it kind of sucks the shoulder blade into the rib cage and actually acts as a primary stabilizer for that shoulder blade. And the shoulder blade is really important for swimming. We're going to talk about the rotator cuff in just a little bit, but that's kind of where the rotator cuff lives. And so in order for the rotator cuff to really do its job, the serratus anterior muscle is working really hard. I just put this slide in, it's just goofy. So I don't know, it's just kind of funny to see the action of the muscles and how they're working just a little bit. I don't know who this guy is, but I don't know, maybe he deserved it. So, okay, here we have some the muscles of the core. They're really active through both the push and the pull. They really do act as a link from the upper body to the lower body. And for example, just to kind of think about like what does that mean? Think about as you're pulling down into the water, you're able to kick actually harder because you're creating tension against the water with your hand and arm. You're able to transfer the energy you're creating down through the abdominals into the lower extremity, and that's going to provide kinetic energy to use for the kick. It's a lot easier to kick harder when you have tension, as opposed to just free kicking. If you were just kicking without using the use of your shoulder or your abdominals, then it's actually, you're not going to get as much force production. So the abdominals provide a great link from the upper body to the lower body. It's also interesting just to see kind of the layers of these muscles. The core muscles, what we think of the abdominals, we've got the rectus abdominis, that's our six-pack muscle, but there's a few more that live right around there. You have the obliques, which act as like a sling, and you've got the deep layer, the transverse abdominis, which is a crucial muscle for core stability. And I'm gonna show an image later that really demonstrates the cylinder of the core and how important it is to have tension kind of at all parts of the cylinder, and how that's going to create as much stability as possible through the spine. And when you have stability through the spine, you have good force production, a good link from the upper body to the lower body. This slide is also really interesting. If you look at the one on the left, you actually get to see the hip flexors, the psoas and the iliacus. And both of these muscles, we kind of just commonly throw these muscles together and we call it the iliopsoas. And the iliopsoas is a massive hip flexor. It brings the hip forward. We're going to talk about the iliopsoas a lot in running and in cycling, but it does play a role here in the swim as well. It also, as you see, the psoas, it connects into the spine. So it actually acts as both a spine stabilizer and a hip mover, which is, it's just a cool muscle. And it's a big, when this muscle gets really tight, we actually have a problem. We'll have back pain, we'll have hip pain. So this is another muscle that as a physician, I look to try and treat all the time. So, okay, the muscle of the diaphragm. So as we kind of move downwards, well, I guess we're moving upwards now. The diaphragm is it's a muscle that lives inside the rib cage and just below the lobes of the lungs. And its main role is to, when it contracts, it actually descends downwards and allows more space for the lungs to fill downwards and outwards. So its primary role is to allow you to breathe, but it does have a unique role in that it acts as a dome to the core. So if we think of the core as a cylinder, and we've got a front, a back, a top, and a bottom, Well, that top is the diaphragm. And when that's strong and engaged, that's creating stability and pressure downwards, which we want, which we like. So breathing is super important, not only to get oxygen into our bloodstream and into our muscles so that we can keep swimming, but it also provides a stable pressure that creates balance in the core, and once again allows for more kinetic chain activity from the upper to the lower. So it's a really cool muscle. It often gets overlooked when talk about training. But if you talk about breathing in your training, then we're talking about the diaphragm. And there are ways to really train this muscle to make it as important as possible. Here is just a demonstration of kind of how that diaphragm works. So as it contracts, it actually lowers down and allows the lungs to fill up. So again, you can kind of visualize that there's downward pressure from the diaphragm into that cavity, into the abdominal cavity, creating that stability, or at least creating a downward tension. So this is a pretty cool image to kind of see, and that's how the diaphragm works. If we move to this one, then we can see kind of that cylinder again. And we've got the diaphragm at the top, you've got the pelvic floor muscles at the bottom. That's a whole nother lecture. We could talk about pelvic floor, the abdominal wall muscles in the front, and then all the lumbar stuff in the back. And again, if I'll see if I can get this to play. Yep, there we go. So we can kind of see the tensile relationship between breathing and core stability, and how important it is to have really strong core for a variety of reasons. So we'll move on to the lower half for now, and we're going to talk about the kick. So the flutter kick is, well, here's an image of the front of the hip and of the leg. And the kick does begin at the hip, in particular the hip flexors and the glutes and hamstrings, as the hip and knee bend. So these muscles are responsible for kind of starting the kick, right? At least the top of the hip is. And I'm going to show you an image later that kind of demonstrates the cascade of reactions that a small movement at the hip will then create a larger movement at the knee, and then an even larger movement kind of in the lower leg. So, but it all starts here, and it's good to have good control here, good strength, so that you can produce a really strong kick. And I'm sure Joel has talked about how important it is to use the kick all the time, as opposed to just when you think that you might forget that you've forgotten to use it, right? I think that's kind of what swimmers do. We just kind of get going, or like, oh yeah, I haven't kicked in a while. So it's important to kick. Here are the muscles of the hamstrings. Hamstrings are really important because they bend the knee. And when we're kicking, we're flutter kicking, we do want a good amount of knee bend in order to produce the full action of the kick. And so the hamstrings are made up of 3 muscles. The biceps femoris lives on the outside, and you have 2 muscles that live on the medial side, or the inside of the leg, the semitendinosus and the semimembranosus. And all 3 of these kind of work together to produce a similar action, which is to bend the knee. But they also extend the leg back. Like when you're swimming in your horizontal, it actually helps kind of, I mean, it's bringing the leg upwards, backwards but upwards to create more tension that can be used for kicking. So we can just watch this video and really see the cascade of reactions from the hip to the knee to the lower leg. And so you see a smaller movement at the hip, and the hip flexors and the glutes and the hamstrings are all engaging here to produce a bit of a knee bend. And then the movement of the ankle is usually, the ankles usually stay downwards, but just for aerodynamics, and we're also producing force that way. So once the arm gets past chest level, but still in the water, we're going to activate a different set of muscles. So it's a difference between when you're first getting started in the pull and you're finishing the pull. we're going to get a different set of muscles, and we're going to get some activation out of the triceps and the rotator cuff. And that's going to help you get the arm past your chest, down towards your waist, and then up and out of the water as we begin the push. And I will show the rotator cuff in just a second. So the push, yep, it's consists of, now the arm is moving kind of out of the water and around the body to get back into the water. The movements here come from the muscles of the shoulder called the rotator cuff, muscles that connect from the shoulder to the spine called the rhomboids, the upper trap, and the levator scapula. All those muscles work in tandem to get your arm out of the water, around your body, so that it can re-enter the water. So here's a better picture of the rotator cuff. You kind of have a little bit of imagination to see kind of what's going on here, but you're looking at the shoulder blade. The posterior view is looking at it from behind, and the anterior view is looking at it from the front. And so we have 4 muscles that make up the rotator cuff. And I'll start from top to bottom. We have the supraspinatus, the infraspinatus, and the teres minor. And those all live on the back of the shoulder blade. But if we look at it from the front, we'll see one big muscle that lives on the inside of it, and it's called the subscapularis. And that muscle is also part of the rotator cuff. So the only muscle that's listed here that kind of gets left out is teres major. It's not part of the rotator cuff. However, it is engaged during a lot of the stuff, but it gets left out. I don't really know why, it just does. So, and then on the other slide, we're looking at muscles of that attach from the scapula to the neck and to the rest of the parts of the spine. And these muscles are going to be engaged when you're lifting your shoulder blade up and out of the water. And those are the rhomboids in the levator scapula. And then as we move, just looking at just isolating the muscles of the spine that connect from, kind of go long ways down the spine. These are called the erector spinae muscles. And the erector spinae muscles, they keep us erect, and they keep us upright, but in swim, they're going to keep us horizontal and parallel to the floor. And they'll allow you to kind of get your head up. And there are some cervical rotator muscles that allow you to turn in order to breathe. Here's a great video of the swimmer in action here as he's rotating his head to breathe, but we get to see everything here. Like the erector spinae muscles are keeping him parallel. We're seeing all the action of the pull, and you get to see all, the pecs involved, the lats involved, the abdominals are getting worked. Obviously your neck muscles are really active through here. So this is just a great little image to see and visualize all the muscles that are working in tandem.
Just quickly, Evan,
Yep.
the difference between pool swimming and open water swimming, we have a sighting component. So we are literally lifting our head, in front of us to see something on the horizon. Can you maybe go back one slide and give us a quick, or 2 slides? Maybe it's right here. Are these same muscles up here around the neck the ones that are pulling our neck up out of the water this direction for sighting in open water?
Absolutely. The erector spinae muscles are doing that, and those muscles are divided up in between parts of the spine, from the cervical spine, the neck, the thoracic spine, the mid back, and the lumbar spine, the lower back. And so we have several muscles that live in the neck that just provide that motion, right? Just lifting the head up into extension. And they're constantly involved, they're constantly engaged, but when you're having to, like you said, kind of look up at the horizon and see, then they're really pulling pretty hard. And in order to rotate, there are some muscles and fibers that orientate in a way that allow for a little bit of rotation. And there are even smaller muscles that live just on the spine that produce that rotation. They're called the rotators. And I don't have a good slide of that, but I mean, they're super tiny. I mean, they're as big as an inch or two, and some will cover more than one segment of this, or more than one cervical segment of the spine, but they all kind of work together to kind of bring that extension and rotation.
So we're going to have this conversation again when we get to the bike portion, because when we're in the aero position, you know, our back's going to be down, our head's going to be up.
That's right.
Being able to keep that position for a long time, you know, it can be difficult, and especially if we have a new bike fit, those back muscles, neck muscles are going to hurt until they get used to it. But from a swimming perspective, in my coaching experience, I feel like we don't ever warm up our neck a lot, but yet we're breathing to both sides all the time. And in open water, like you were saying, we're adding that extension on top of it. So we're really working our neck to breathe and sight, and breathe and sight. And so maybe towards the end, I know we're going to do some stretching and stuff. Maybe we'll come back to, maybe you can give us a tip or an idea of how we can warm up that neck, or exercise or strengthen those neck muscles too.
Absolutely. Yeah, it's so vital to have a strong base. And we're going to think that the neck muscles need to get strong, and they do. But if we just go a segment below, just a few, like a little segment below, kind of in what's called the cervicothoracic area, which is where the cervical spine meets the thoracic spine, we typically call that a dead area, because that's an area that if you look at anyone who's kind of hunched over like this, we're going to find that that's where all the tension gets displaced, and there's a lot of muscular involvement there. And if we have a really strong muscle, just a region, we have a stronger region through there, then it allows a better base for your neck muscles to extend. But a weaker area through there has more forward rounding, and even harder way to get your head up. So to have good posture through a lot of that stuff, or to train those areas and get strong and to endure, is going to be extremely important for the swim and of course the bike. And I'm going to say for the run too. So just important all around. And your desk job, if you have a desk job. All right, so just how does the upper body balance the lower body? I think we talked about this in depth. I mean, the core is just such a huge link from the upper body to the lower body. And this is a great image of kind of just kind of being able to see the symmetry involved of one arm, one leg. You know, one arm, the opposite leg, they're producing that tension. Kind of think of a line going from her left shoulder to her right hip, kind of diagonally, kind of obliquely. That tension is always being displaced in that way.
Yeah, when I'm training, I always come back to talk about we're one big X, and
Yep.
our arms counterbalance our legs, and that's true.
Bingo.
Every discipline, you know, each sport in triathlon. And you know, I'm glad you talked about that cylinder. I'd never conceptualized that before, but having that cylinder tie that X together is critical.
Oh yeah, definitely. And it just, that ties in perfectly with this slide here, because how can we train those slings, you know, those kind of the oblique slings from one arm to the other leg, you know, getting in a plank position and doing different plank variations is really important. And it kind of trains the body to get really good at it. The guy, the slide on the left, you can really see that, you know, with balance, the opposite leg has to be engaged at the same time. It's impossible to do the same arm, same leg. You can try, it's really hard. You're going to fall over probably. So, and that just kind of identifies that whole kinetic chain. So most common injuries with swimming, we easily see, and this kind of ties into what you were talking about, Joel. One, shoulder impingement and rotator cuff injuries are our number one in swimming, but a number two are going to be your upper back and your neck pain. And part of it too is, like you said, just getting used to those positions is going to be uncomfortable as they go through a transitional period from not having to be that conditioned to from being, I should say, into a deconditioned state to a conditioned state. So usually when we go through that phase, we have pain and we have discomfort, and we can get into that. There's a difference between being hurt and actually being harmed. And I would say most transitional pain isn't really harmful. It just is uncomfortable. And but I think there are ways to train those things so that it's minimized and doesn't be so off-putting that you don't want to do it again. And there are cases where it can be harmful, but I mean, in swim, having some upper back and neck pain is very common because of those reasons that we talked about earlier. And then just below that, I'll see some hip flexor and some hip labral injuries as well. The labrum is a piece of cartilage that lives inside the ball and socket joint. And I'll see that also. There's a labrum in the shoulder. Probably should have included that too. I'll see a lot of labral injuries in the shoulder. But those are the most common things that we'll see in swimming. And so, what can we do to maybe prevent some of this stuff? And I just provided just 3 kind of basic exercises that I kind of ran across that I really liked. The slide on the left shows an assisted thoracic rotation exercise where it's helping you turn that upper torso. It's teaching that motion, kind of disassociating the upper body with the lower body in terms of rotational aspects. So her pelvis is pretty level, but she's really rotating through her spine and getting her arms up very high and her shoulders up very high. So I really like that exercise. Top right is the hip flexor stretch. It's important to have loose hip flexors for a variety of reasons. One is to prevent back pain. One is to prevent hip pain. One is to prevent knee pain. It all kind of ties in. So having nice long hip flexors also provides strong hip flexors. So I like good hip flexor stretches, especially if you have a desk job anyways, like most of us do. So you're always sitting, your muscles are always tight. So it's good to get a good stretch and just open those up.
There, Evan, I was just talking with a friend of mine. He's a personal trainer. We don't get enough. Well, I'll say it this way: with cycling, we have a lot of hip flexion. That knee is in front of us. With running, hip flexion again. The knee is in front of us. Swimming, it's almost the exact opposite. We have a lot of hip extension, and that cross training is really important to keep us healthy. And so we get hip extension here where we have constant hip flexion with the other 2 sports. So in my opinion, really to focus on the hip extension here is critical to improve the cycling and the running, because those 2 sports are constant hip flexion. So
yeah, that's such a great point. And I'll bring this up in another lecture, but you're 100% right. And when you're in a sport that has a good amount of hip flexion and a tiny amount of hip extension, what's going to happen is the hip flexors are going to tighten up and they're actually going to pull on the spine. And when we pull on the spine, we get you're going to get into an inadvertent extended position in the spine, and that's going to cause other problems. It's not going to be good for your back. It's not going to be good for your hips, and it's actually going to be bad for your efficiency. And so having long hip flexors as best you can, it's an uphill battle in triathlon for exactly that reason, because there's a lot of hip flexion involved. And so it's important to take the time and try and loosen those up at least to some degree. And then just the last one, floor slides, laying on your back, just getting your arms back and just kind of even sliding up and down, almost like a snow angel type thing. Great for shoulder mobility, great for actually thoracic mobility and neck positions. I'll find that a lot of my athletes can't even get the back of their neck to the ground. Sometimes the thoracic spine is too rounded. I especially see that in cyclists, which we'll talk about, is having that really rounded thoracic spine. And so it doesn't allow for very good cervical extension. So this is a great way to just kind of get some of it back. Lay on your back, let gravity do the work, bring your shoulders back. It's good for your shoulders, it's good for your neck, it's good for your back. And yeah, I just found this slide. I think it's really hilarious. So that's it for what I would call kind of the functional anatomy of the swim. Are there any questions?
Just going back just one moment to the neck. Is there any
Yeah.
tips or any exercises you might suggest for, strengthening or stretching the neck?
Yeah, going back to the neck, we do want to provide a good amount of extension, but also not just in the neck, but also in that upper thoracic spine area. And so there's an exercise called a crocodile press up, where you lay on your stomach, you place your hands out in front of you with your elbows on the ground, and we're just going to kind of press and try to extend that upper portion of the back and your neck and head. And so we're going to try and activate that, and you should feel it kind of right at the base of your neck, kind of almost in between the shoulder blades, but even just a little bit higher, where the mid back turns into the neck. So we want that area to be really, really strong and active. It won't take long for you to feel that. You'll probably get a burning sensation because it really hasn't felt like it's been active in a while. Another really good exercise is to flip over and lay on your back and do what's called chin tucks. A chin tuck is where you're going to lay on your back. We're going to bring our chin down almost towards the back of your neck, and we're going to strengthen up a couple things. We're going to actually elongate part of the back of your neck, and also strengthen some of what are called the deep neck flexors, which are really, really important when it comes to proper curvature of the neck. So chin tucks are also very important. And then lastly, just doing isometric cervical spine exercises are really, really easy to do, and they are beneficial. And what an isometric exercise is when there's a contraction, but the muscle doesn't move anywhere. So an example would be is if I were to put my hand on the back of my head, and I'm going to press backwards into my hands, and I'm just going to hold that position for 10 seconds. So the neck muscles are going to be active, but they're going to kind of run into my hands, so they're not really going to go anywhere. But we're going to just get that contraction there, and we're going to try and hold that for about 10 seconds and then relax it. Then you're going to move to another plane of movement, flexion. We're going to go forward, and we're just going to press down into your hand, hold for 10 seconds, then move to the side, press into your hand, hold for 10 seconds, going this way. Very, very simple to do. And then lastly, rotation, just rotating up against your hands that way. Very simple, very easy to do. Can do it at your desk. Doesn't take long. Doesn't require gym equipment. Doesn't require bands. Literally requires your hands, which I think we all have at this point. So great way to just get a little bit of strength in your neck is to do some isometric exercise.
Awesome. And just to back up one more time here, you had listed out the common injuries. Would you mind if we maybe went through each one of those? Yes, right there. And just give us like one or two exercises like you did with the neck there of something someone might be able to do on their own. Again, certainly we want them to go seek professional help when needed, but for something that may be minor or only appear after one workout or something, what's a good simple thing that might be able to do for each one of these here?
Yeah, it's great. What's kind of fun about when we rehab certain injuries, I can take those first three and give you one exercise for all three. And that's a row, like rowing, not rowing on a rowing machine, but like a cable row or a dumbbell row, a bent over row, any kind of pull movement where I'm bringing the arms backwards and we're engaging the shoulder blades back behind you works for all three of these things. because it's that area that's usually weak or inhibited that causes all three of these types of injuries. They just show up in different ways. So for shoulder impingement, I'm going to tell you to do a cable row. For upper back pain, I'm going to tell you to do a cable row. For neck pain, I'm going to tell you to do a cable row. All to strengthen up those rhomboids and the middle and lower traps to get the shoulder blades stable again, because that's usually what's happening is the shoulder blades aren't stable. They're too far forward. You're rounded. Your posture is too forward, and it's giving you different symptoms in different areas of the body. I can add to that by telling you, if you have a rotator cuff injury or even just shoulder impingement, doing rotator cuff exercises are actually good for it. And they're really basic. You can take a band or a low resistance and do what's called external rotation, internal rotation, where the band is going to come across you. You're going to grab onto it. Elbow is going to be tucked into the side, and we're just going to rotate outwards this way. Turn and face the other way, have the band coming from the other direction, and do internal rotation, where we're going to bring the arm closest to you. Now, that's going to be kind of like more in this position. So we're going to be externally rotating and then internally rotating. So you can do those. You can get into a position here, have a band that's coming out in front of you and rotating back behind you, like so. This one's usually a little bit more advanced. So as long as you don't have pain, you can do that one. Upper back and neck pain, like I said, rows are great. They're just terrific for you. Hip flexor stuff, we're going to move to the glutes. We're going to get the glutes really strong. So a glute bridge is a fantastic way to get your glutes active and also open up the hip flexor just a little bit. Pretty much any hip injury, we're going to do some glute bridges. The glute bridge is when you lay on your back and your feet are together and you're just going to lift the pelvis up off the ground. It's a very simple exercise. I like to make it a little bit harder by doing a single leg glute bridge. So it's going to add a little bit of a challenge to it, and it should get enough of a contraction to make you work. And all these things you can do like a rep scheme of anywhere. I mean, 3 sets of 8, 3 sets of 10 is pretty common. If you want to get things really strong, you kind of need to move to a 5x5, 5 sets of 5 reps with a little bit heavier weight. But that's kind of more, we'll kind of talk more about training when we get to the strength training aspect of it. But because strength training really is it's injury protective, and but it also works as rehab, just in a slightly different way.
Well, just reached out to Chuck on the message board, and he said he did not have any questions as
Okay.
we've got a few more minutes here. Do you mind if we go back one more slide, 2 more slides to, yes, our guy in the plank here. I just wanted to, I really like this. I haven't seen this before, but I really liked your suggestion here of doing these planks. And one thing I always teach from my strength training perspective are there's 6 major movements that we need to work on. And one of those is the pull. You know, going back to what you were just talking about, I was really kind of amazed that, you know, 3 of the most common injuries in swimming that you come across are fixed by just one motion.
Yeah, it's such a huge foundation to getting things strong and back into position, that we're also like anterior dominant. Everything is just folding forward, rounding forward, and that causes many different kinds of injuries. Just depends on the person. But I mean, when you're in these positions, you're more susceptible to pain in your shoulder, your neck, your upper back, your lower back even. So what can we do? Well, we want to open things up. We want to get to the opposite of that. And so row is just such a great way, or like a reverse fly is such a great way to just kind of open up the chest, get the neck back again, get the shoulders back, reintegrate that patterning. And so by doing so, you eliminate the cause of the problem. You know, the cause of the problem is the dysfunctional movement pattern. The symptom is the tear, right? The symptom is the impingement. That's what you feel. That's your pain. That's the tissue that's irritated. but it's the poor movement pattern that's actually causing that issue to even occur. So when you get to the cause of it, it's really quite simple. Like, let's get you there again. Let's get you in this position, and let's get you strong in that position, because you're going to be like this for a lot of the time. So we got to counterbalance it sometime. You can't spend your entire life like this to get away with it. You just can't. So, and in triathlon, like you said, you're in that position a lot. So, especially when you get on the bike.
Yeah, so the reason I wanted to come back to this slide is I just wanted to briefly talk about that cylinder again that you talked about within the core, because again, that is so important. And the way I talk about it, maybe our vernacular is a little different, but I talk about tying the X together, and you called it, a tube or a cylinder,
Mhm.
same thing, but maybe talk just one more moment here on maybe a couple of tips on how we can strengthen the core. Obviously there's 1,000 different ways, but I'm not necessarily looking for an exercise, but maybe from your vantage point as a physical therapist, what can we do most often to really either rehabilitate that core or to replicate that patterning that you're talking about? What's
Yeah.
maybe a couple of things that you see that really helps with the core patterning there?
I think being able to link these two things together. So when we talk about core training, I think the old school way was to do a lot of sit-ups and crunches and things like that. And there's probably still a place for some of those, but we generally don't talk about those too much anymore. We talk about how we can hold positions instead of doing that kind of core flexion type move. And in swimming, we're not really doing a whole lot of that core flexion type move. We want that area to be really stable. And so we have to train stability. We have to train in that plane. So this fellow on the left here, I mean, he's doing a low plank with opposite arm, opposite leg. And you can even just visualize the tension that's occurring in his quad, the right side of his abdominals, the left side of his shoulder, the left side of his arm. And what's happening on the flip side of that? His right arm is up, his left leg is up. What's happening there? Well, we've got a lot of tension that's being displaced on the back side of that in the exact other direction, from the right shoulder blade to the thoracic spine, to the lumbar spine, to the left glute, to the left hamstring, and to the left calf. So that X, like you're talking about, Joel, is a functional link. It's an oblique fling. And having a good training program that promotes that type of movement is great for the swim, because those are the positions you're in. We're not doing butterfly. I hope not. I mean, maybe, but usually not. And so just training this alone is such a great way. There's ways to do it. There's low planks, opposite arm, opposite leg, high plank, opposite arm, opposite leg, bird dog, uh, bear position. All of those ways get that going. Stir the pot. If you haven't heard of stir the pots, go look it up. They're absolutely awesome exercises. They do require an exercise ball, and it's a little different than what you're seeing here. But Joel, have you seen those before? Have you done any stir the pots?
I have not. I'm excited to go look it up.
Stir the pots are really fun. They really get your lower abdominals engaged. Uh, they're not necessarily sport specific, but they're just a great exercise to try out. So love a good stir the pot. But yeah, I mean, just to kind of go back to the cylinder, I'll just kind of briefly try to bring up that slide. We need to have tension in all directions: upward, downward, anterior, posterior. That all creates a symmetrical core. What happens when one side isn't working as well, or maybe two sides aren't working as well? We have an inefficiency, which means the energy that you're producing on the top half of your body or your lower half of your body isn't getting to the other side very well. All right. It's loosey goosey, right? And what is that doing to your body? Well, it's probably making other areas work harder to create trying to create that stable function, which then leads to repetitive motion injuries because now you're asking other nearby tissues, other nearby regions to work extra. Well, they're already working anyways, but now you're asking them to work even harder to do a job that, maybe the diaphragm should be doing, or maybe the pelvic floor should be doing, or your abdominals. And so when that happens, well, now we've got a poor movement pattern. We've got repetitive motion injury waiting to happen and an inefficiency of movement. So sports performance and injury prevention, they really do work in tandem. They work hand in hand because they just do. I mean, a functioning body doesn't hurt as bad and it works better. So just to kind of visualize this cylinder in this way, you want to have pressure kind of everywhere. And to train that, breathing exercises for your diaphragm. Diaphragmatic breathing is a key term that I like to use in the clinic. Planks, holds, carries, things of that nature to produce abdominal wall tension. It also helps with spine stabilization. And then you get into the pelvic floor stuff, which is when we're really isolating that stuff, it's Kegels and it's other adductor and groin type movements and just lower core type movements that are usually they get involved whenever you're holding things and carrying things. So, when I divvy up core exercises there might be some movement, like maybe a flexion, maybe, or an extension, but a hold and a carry, I love. If you're going to come to me in the clinic and I think you have a weak core, I'm not going to have you do 100 sit-ups. I'm going to have you carry something in your hand. I'm going to have you do a suitcase carry or a farmer's carry, or I'm going to have you do some glute bridges, things of that nature, bear crawls, right? Things to kind of get all the points of the core to get engaged and strong.
One that I've come across here recently that I've actually started to incorporate in my programming is a cook carry. Are you familiar with that one or heard of that one?
Yeah, absolutely.
And at least the one I'm familiar with, you start with it overhead, then you come down with it in the rack position, and then you come down to a suitcase carry. All the while you're working on the top of your swim, the push phase of the swim, and then the pull, and then the push phase of the swim. And that's been huge because, again, the opposite side of your body is engaging. And the cook carries have been really, really good for this.
I love that exercise. I love that kind of those progressions where you go from high to low or low to high.
Yeah.
You can get into the front rack position there, like you said. You can also go bottoms up, a bottoms up kettlebell, and add a little bit of more of a dynamic stability component to it. So yeah, the cook carries are great, suitcase carries, farmers carries. I just like holds and carries. I just think that they make you stronger.
I'm glad you brought up bottoms up because I do program and train a lot with kettlebells. And when you turn that kettlebell upside down, it's like all of a sudden it engages that much more and you've done absolutely nothing. And
yeah,
really works on those small, like you said, stabilizer muscles that typically don't get worked. Athletes that typically come to me are usually strong, but they're strong with those big muscles, a bicep or a thigh, but they're not necessarily, strong in those little muscles that we're talking about, core muscles, that whole cylinder pulling it all together. But yeah, throwing in that bottoms up kettlebell has really helped me in particular, but really works those tiny muscles that we forget we even have.
Yeah, absolutely. Yeah, no, absolutely right. Bottoms up is a great move. It helps correct things, right? Like you're self-correcting all the time, and it trains not only those tiny muscles, it also trains the brain. And when we get into that type of training, then it's an even higher level of way to go about it.
Well, let's close on this. I've got one last question. I want your input here. I've come across several things here recently, and then again, in my own personal experience working with you, I don't know that we've necessarily talked about this, but this is what you're programming for me is when we have, can you talk about just really briefly the difference between, when we are injured, strengthening that injury as a form of recovery versus resting that injury as a form of recovery? I know there's a time for both, but often it's the movement that repairs, it's the strengthening that repairs. Can you maybe talk to that a little?
Yeah, sure. It's it a lot of that is dependent on what the injury is,
Sure, yeah.
what how severe it is. But I think to your broad point is movement is helpful. A lot of times we want to keep something moving in some degree, unless it's a catastrophic injury, right? Where there's a full tear or an avulsion or something like that, or a fracture. Um, but I even just saw this morning. I had an ankle sprain come in this morning, and they went to an orthopedic. Orthopedic said, we need to boot this, and we're going to rest it for 2 weeks. And I took a look at it, and I'm like, yeah, it's a sprain, but we can rehab it. We need to keep this thing moving, actually, and that's what all the research says to do. As soon as you introduce rehab, as soon as you introduce movement, the better it gets, the faster it gets. So yeah, he'll get better in 2 weeks, but he'll get better in 2 weeks also, but he'll have a faster track through his rehab program if we can get the movement done a little bit sooner, a lot sooner. So just to speak to your point, like movement absolutely matters. Rest is context dependent, and absolute rest is different than relative rest. Which absolute rest, I would say, is I rarely put someone on absolute rest. It's so rare. Most of the time, um, and we're talking with, I'm working with athletes where it's like they are training 6 7 days a week. They're used to moving. They have to keep moving. They have to keep their fitness up when they're injured. And so you can't do that with a boot on your leg sitting on your couch. What can we do? Well, maybe we can do something for the upper body. Maybe we can do some kind of like ski erg or something like that just keep their fitness up a little bit. Hand bike, anything. But movement helps. It keeps it kind of gets the inflammation cycle to peak and then valley, which is what we want it to do. Kind of go through those stages, and it does help speed up, facilitate the process of getting through it. But also, I mean, keeping my athletes' fitness levels high is usually the challenge when we have an injury, because if we're going to sideline somebody in the middle of the season, like it's just it's really hard. It's really hard to come back from. It takes forever. So if you can keep them moving, the better they are going to be mentally and physically.
Well, good points. Yes, that was a good explanation, because again, I've had experience with both, and there's as you said, a contextual reason for both. But I've found that a lot of times, the right type of movement just introduces more blood flow, it introduces quicker healing, and it's been my experience as well, working with the right person and working with the right protocol to make sure we're targeting the right muscles, and et cetera, et cetera. So, well, Dr. Kahn, I really appreciate you taking your time tonight. Chuck, I'm glad you joined us. I'm glad we got this first one in. I know it's a weeknight, and we'll probably have more people check this out for the rerun. I'll post it on my website, but look forward to the cycling one here in a few more weeks from now. But again, thank you, Dr. Kahn, for the preparation and the breakdown, and then the advice. So
Absolutely.
one last thing, Dr. Kahn's located here locally. He's in Holly Springs. And so my athletes, if you're an athlete of mine, you do get a complimentary analysis with him, or a consultation with him for 30 minutes. So That's something to a quick plug in for you there, Dr. Kahn. But again, thanks for your time tonight. We'll end it there.
Okay, thanks, Joel. I appreciate it very much, and we'll look forward to the next one.
Absolutely. Well, have a great night.
All right, thanks. You too.